To this info session on the Allergy postgraduate program at Imperial. I'm Dr. Marta Vazques-Ortiz. I'm the program director, and I'm a consultant in pediatric allergy at Imperial NHS. So you see my lovely NHS background with lots of bits and bobs there. So welcome to this info session. We're gonna have a few things happening. So first, I'm gonna do a little presentation about the program, just with the basics, to set a bit the scene, and then we're lucky to have two of our students, Raman from Denmark, who's one of our year one, so PGCert students, and then Aisling, who's one of our year two, so PGDip students. So Raman is a GP from Denmark, and Aisling is a dietitian from the UK. So they're going to be sharing their view on how things are going and how they're finding things in the program. And that should allow us about up to probably 30 minutes for questions that you might have. And then for questions, you can use the chat and type your questions, or you're very happy to put your hand up towards the end in the sort of the Q&A we do after the three bits with us. And we, of course, let you talk and ask your questions there. Okay, so yeah, we're generally very friendly and very approachable. So you know, if you think a question might sound uncomfortable or whatever, it doesn't matter. If you think you want to know about that, absolutely feel free to ask us questions. Okay, who else is in the call that you might want to know about? So my colleague Jen Hiley, who's our program administrator, is with us. And then there's a couple of other people, Rachel and Helen, who are part of the department, so NHLI, in the call. So yeah, welcome everybody. So I'm gonna get started. I'm gonna share my screen basically to show you a couple of slides, and my colleague Jen, if you can just keep an eye on the chat and things, if there's anything important, or if someone unmutes themselves and there's noise. So it would be great if you could keep an eye on that. Okay, so can you see my screen?
Yeah, we can.
Yes.
Lovely, thanks. Great. So yeah, welcome to this info session. So I guess this is the big questions of what you get out of the program, and it's very much becoming an expert in allergy. Okay, and why to choose Imperial? There are other educational opportunities at postgraduate level in allergy, of course, but Imperial is a fantastic institution. It's top 6 university worldwide, and you know that's a big thing really. And you really take advantage of the whole range of resources that such a great university has to offer to students in terms of, so say, more generic resources, and also the community, the student community at Imperial is absolutely amazing. And in our program, there's so much sharing and learning from the students, and there's such a strong feeling of a cohort, of a network there that students, I believe, really value. So great institution, and lots of recognition, including in the last years, about the contribution in research and education nationally and internationally. And then when it comes to allergy, we kind of like to say that Imperial in a way is the home of allergy. There have been fantastic developments over many years, starting with the first immunotherapy, allergen-specific immunotherapy being developed at St. Mary's Hospital, where I'm based, over 100 years ago with Noonan Freeman, and then fantastic figures, say, of the 20th century, like Dr. Bill Franklin, who ran the first randomized controlled trial in allergen-specific immunotherapy and set up one of the first and biggest clinical allergy services in Europe and the world in the 50s at St. Mary's Hospital. And then Professor Barry Kay, who was based in NHLI at Imperial and did fantastic developments and discoveries in research in terms of Th2 inflammation and eosinophilic inflammation being key pathways in asthma, which has then opened the way then to develop very effective therapies for this. And this is what leads us to having, you know, a fantastic group of faculty members, of module leads, and you see quite a few faces there. So if you've been in the allergy field for some time, you might recognize some of those faces. You see Steve Dara, Marta Kustovic, Sergio Saglani, Andy Bush, Paul Tana, Bob Boyle, Rosanne Meyer, Isabel Skipala, Mo Samji, Louise Fleming, and myself there. So you will recognize some of these names as really world-leading experts in their field in asthma, rhinitis, immunotherapy, food allergy, anaphylaxis, mechanisms of immunotherapy, etc. So you're really talking to the people who are very much hands-on in the field, doing fantastic research and with very strong links and work in clinical practice as well. So our program is really comprehensive and holistic. So we have an extensive syllabus covering from the immune mechanisms related to allergy to the very sort of latest in terms of clinical practice and the diagnostic and therapeutic strategies. So you really touch on all the different areas. And it's very much student-centered active learning with a blended format as well as online format, as we will see. And it's very flexible and it's very much international, both the faculty as well as the students. And I'm talking a bit more detail about how the teaching is delivered, but you will see that most of our students are healthcare professionals working generally full-time, and they manage to carry out their studies as well as working. So yeah, who are our students? So mainly healthcare professionals, quite a few doctors from different backgrounds, as you see here, pediatricians, GPs, allergists, dermatologists, chest or ENT, as well as other specialties, and then specialist nurses, dietitians, biomedical scientists, and people from other backgrounds, people working in industry, willing to kind of pursue a career in asthma or allergy, or people with other backgrounds such as epidemiology or pharmacology that we've had over the years. And these are some of our recent students. You can go on the website and have a look at what they say about their time with us, where they are now, and how being part of the program has helped them in their career. But really sort of outstanding people, lots of different backgrounds there, as you will see. And this is very much the structure of the program. So it's part-time, okay? And again, most of our students work, if not full-time, pretty much full-time, or they have family, personal commitments, so they're very busy. And they do that alongside their other commitments. So the program is structured in 3 years. So the first year is the postgraduate certificates, and there you have 3 modules, 10 credits each. So the first is scientific basis of allergy, which is very much about the immunology and the mechanisms underpinning allergy and how this relates to the diagnosis and treatment. The second module is the diagnosis and treatment of allergic disease, which is very much a practical module, very relevant to clinical practice, incorporating all the latest advice and guidelines in the field. And then the last module in year 1 is the cutting edge of allergy, which is very much about what's the latest in research, often, of course, with implications for clinical practice. And it should also give you the skills to start developing your own research projects, just thinking about transitioning to the MSc level. And we give you those skills, and there's a lot of practice around that as well. So that's the first year. And then you can decide if you want to exit at that stage, which most people don't do. They carry on with us, and then they move into, say, the second year, where you have 5 modules, a big module, the food hypersensitivity one, which is 10 credits, and then 4 other modules that are smaller, so 5 credits each. And you see the other modules are rhinitis and immunotherapy, asthma, allergic skin disease, and pediatric allergy. And there you go in much more detail about all the different disease areas, again, covering from the mechanisms to the diagnosis, treatment, what's the latest, what are the controversies, the difficult areas. So there's a lot around case-based learning, so complex scenarios, challenges, etc. There's a lot of group work to work on those areas within a group and do some peer learning. And then people can decide to exit at that stage or carry on and do an MSc research project and complete the full MSc. So the MSc project, most people do in a 3rd year as a standalone, say, 3rd year, and a few people manage to do it in year 2 alongside the modules, but it's quite challenging. But we've had some students successfully doing that. And the research projects can be done here at Imperial with us, either clinical research projects or lab-based projects or dry lab-based, so kind of looking into existing databases, etc. This will be, say, an Imperial project. And then many of our students prefer to do a local project in their own institution, in their own country, with a local supervisor, and they also get an Imperial supervisor linked to their project for support. So these are the options there. And then how do we deliver the teaching? So things have evolved very much over the years, I think, for the better. And we very much have now 2 streams, so an online stream where all of the learning is delivered online, and Hof Rahman is one of the students in the online stream in year 1, as well as a blended stream. A blended stream means that you have some of the learning online, which is shared with the online cohort, and that's probably about 70% of the learning. But then there is on-campus attendance as well, which is 3 times in the year, generally 1 or 2 consecutive days each term. Okay, and then within sort of the learning materials, we have what is called asynchronous materials, so things that you access on your own time, that are sitting on kind of your computer or on something called Blackboard. And there you find a number of things, a number of resources, so lectures, mini lectures, good reading lists for each module, some web-based resources and tasks for you to work on, either individually or in groups. So, you know, we launch the module and we give you access to all these materials with good guidance about how to approach it, what to do at each stage, etc. And that prepares you to, you know, for the live sessions, so the synchronous sessions, and for the blended stream, part of that happens online and part on campus. For the online stream, all of that happens online. And the live sessions are very much for interaction, to get together with the faculty, with other students, to ask questions, practice, and you see lots of different types of sessions there. Case-based discussions, sessions, workshops, role play, simulation, hands-on sessions, lots of student-led sessions and group work, pro-con debates, presentations, etc. So it's a lot of applying, a lot of learning by doing and putting things into practice. And this is how an example module looks like. So we launch the module, say, in week 1, and then you have access to all the materials and know what to do. And then, say, a couple of weeks later, we have an online live afternoon, say, where we have warm-up sessions, some Q&As, focus discussions, and then, say, the following week or a couple of weeks later, it's the main teaching week where we have a couple of days of, you know, full-on live online learning, as well as the on-campus days. And part of the on-campus sessions are live streamed for the online students, with full capacity for the online students to interact, to ask questions, type in the chat, present, talk, etc. So it's very much hybrid teaching, and it's working really well. So what assessments are you going to have to complete if you join? So a range of assessments which are meant to be authentic, so things that you will probably need in your professional career in allergy. So things like writing case reports for a journal, running a mock allergy clinic, writing a research application, presenting a poster, an oral presentation, running a patient info evening, or writing a review paper, or doing some quizzes and written exams about sort of key concepts. And of course, if you do the MSc, you're going to write a thesis, which is basically an original article, which should make it easier for you then to sort of try and publish your work. So there's a range of things there, and there's a lot of support for you to get those skills and have good results. And I have to say, over the years, most of our students do really, really well, and you see them really learning lots and lots. So this is just a whiz through about how the materials look like. So the synchronous learning. So for each module, you find one of these sort of big colorful tables with all the different sessions we have. And you click, say, there, and you have access to the materials and the recordings, and any tasks that we want you to work on for the live sessions are there. And they're kind of split into different themes and topics. And, you know, this is how, say, a particular session might look like around, you know, a pre-recorded lecture. And then you have within the asynchronous learning, so appropriate for the module, to have lots of practical stuff or interactive materials, so things like practical demos or interactive exercises with a range of formats there, like sim, consultations, cases, or in the immunology module. So there's like interactive diagrams and things like that for you to practice. And this is how the synchronous learning online looks like. So this is our year 1 cohort there, so getting together for some live sessions. And we use things like Mentimeter to do voting, or you know, for people to put their thoughts anonymously about a topic. There's lots about presentations, so using sort of cases and immunology diagrams and things like that to facilitate learning. And this is how the hybrid teaching looks like. So that's kind of people attending on campus as well as remotely, and the 2 cohorts really sort of working together, you know, during the day. And this is some of the on-campus very sort of hands-on elements we do, like sim or messy play with creams or nasendoscopy or skin testing, etc. And people really enjoy that. So last slide, okay, about fees. So you see the fees there. So the information in the website, if you're not used to that sort of thing, it can be a bit confusing. So that's why I kind of put it in a table here. So basically, if you're a home student, it's the same fees for the online stream as well as the blended stream. So you will pay, say, that amount, 7,000 for the first PGCert year, basically, and then as you progress, you add the top-up fee to move, you know, to the next level. Okay, so if you were to pay the full MSc in one go, you will be paying like 13,000. Okay, if you're an overseas student, which is basically not UK or Ireland, it's the price is different online as opposed to blended, but it's the same principles. You will pay like the PGCert fee and then the top-up fee. Okay, so we have applied for a modification to allow you to access, say, straight away MSc if you wish to. So we're hoping to get approval for that, as well as the online stream across the board for PGDiploma and MSc, and we should hear later in the spring about that. And just to say that there are funding opportunities, there is the Faculty of Medicine Master Scholarship that generally the call closes in April, so have a good look. So it's a good amount of money. It's quite competitive, but every 2 or 3 years we get a student in the allergy program that is funded. So I will definitely encourage you to apply. And then we have scholarships purely for the allergy program for our candidates, and the application process is very similar. The deadline is generally around July. We haven't opened yet this year, but we're very much you know, planning to have that as well. And it's a smaller percentage of the fee, but still every little helps, I guess. So that's all from me. So I'm gonna stop sharing and hand over to our students. So we have Horaman Metran, who's a GP from Denmark, who's completing year 1. Are you happy to tell us a bit about your experience with us, Horaman?
Yes, for sure. Thank you. So good evening. My name is Horaman, and I'm a specialist registrar in pulmonology in adults. No worries. Yeah. So first of all, I will say that personally for me, or as a physician or healthcare professional in Denmark, this opportunity, taking the online course in allergy from one of the top universities in the world, is a highly, indeed a fulfills a need in Denmark, because the opportunity to actually get a certification within the field of allergy is not existing. I know it sounds crazy, having working with a field where affects by far a huge proportion of the population, but so here in Denmark I mean, it's always possible to find 1-day course, a 2-day course here and there, but there is no so to speak, a society that would recognize you as a certified allergologist in Denmark. So and obviously having both families and a full-time work on the side, so the opportunity to take this course online was just perfect. So obviously what this course gives me, it makes it possible for me to proceed with a specific interest alongside the general pulmonology I will have in my program. In the end, make it possible for me to having the best and updated methods to diagnose and treat my patients. And I would say that the obviously advantage of taking this course online is it makes it possible with, I would say, with a good calendar and a strict plan. It is actually very, it is indeed possible due to the way that the modules are built, and also the opportunity to have watching the recorded videos whenever you have like 1 hour or 2 hours. And then obviously there are the days where we have the online teaching, but those dates are known from the beginning. And I actually like the idea of having the days collected. Although sometimes it might be a little bit challenging, but when asking your boss, having 3 days off in a row, but the good thing by that is then you actually get zoomed, you get focused into the field again, instead of having 1 day, 1 week, and then have the next lecture 3 weeks later. So having experiences now and being fully active in the second module, I would say I actually like the idea of have those 3 days with online lectures in a row. And obviously, of course, and there's also the obvious differences between having the online version or the blended. But I would say, as a credit to the course directors and all the organizers behind it, they are quite aware of they have a smaller team of online students, so it would always be nice to join the Friday beer whenever they are all you guys meet at Imperial. But I actually think we are in one big team. And also in the online students, we are divided into different groups. And very quickly, I mean, actually before the course really started, we quickly started a WhatsApp group. So we have a lot of communication there. And also we are communicating formally through the Microsoft Teams. And then we have like already created some sort of homey atmosphere within our little group, and I think it is necessary to get the full to get the full picture. And one thing is all the formal education you get by joining the sessions, but actually also learn about the privileges we have in Denmark and what would be nice to have, where because there's the international due to the international students we are. So in our group, we are by coincidence 2 former colleagues from Denmark, but then we are in group with one from Canada and one from Doha. So just talking together about our everyday life and how we practice our in the clinic. That's a huge, very much learning from that as well. And I would say, although it is a little bit time consuming, but I would say the benefit from this course is so obvious, and I already have implemented it in my daily work. There's no doubt that I will continue to fulfill the master's program indeed, although I know it'll be the next 2 years will probably require that I have a good schedule in the evening. So to sum up, I would say if you have a genuine interest in allergy, you should definitely do it, and it is definitely doable, having a full-time work on the side, and also having family and the social commitments as well.
Great, thanks so much. Raman, would you like to comment on the interaction with the faculty? How are you finding this?
Well, I would definitely, I mean, I would say, I don't know how to express this. I will actually say that I could definitely do with less interaction. I think you are very good to reach out, and sometimes we get, I mean, there's no excuse if you have missed a date or if you have missed a task. So the way we get interaction is we both get mails and reminders, both from you and from Jen. who has done a terrific job to make sure that all the students, both the blended and the online students, are aware and where to find all the material, because there's a lot of material, and you could just spend a full-time work just watching all the recorded videos. And one other thing I really want to point out is all the live sessions we have, they get recorded. So if there's some point that you miss, or maybe you have a little kid disturbing you for 5 minutes, then you actually have the possibility to watch the Q&A sessions as well. And I really like that. And normally you would not get that from a blended online teaching, a blended teaching. But so I consider it as a sea of education and material. And for me, I also consider having all those recording as an interaction between the faculty and us, because there's always the opportunity to either ask about a previous session. So I would say I have no comment on the interaction from the faculty.
Great, Raman, thanks so much. We're gonna hand over to Aisling. Would you like to share your experience with us, Aisling?
Yeah, hi everyone. My name's Aisling. I'm an allergy dietitian, and I actually work in Guy's and St. Thomas's in London in adult allergy. I'm in year 2, so I'm in the year ahead of Harriman. And I was asked to kind of speak to you today about what I really like about the course, and I have to say that the quality of the content is absolutely incredible. As Harriman was describing, each module is really well laid out. They get international speakers from around the world, so you're literally getting the top person in their field for each subject matter. And you can access the information, so all the lectures are available online. And I found, like Harriman, that I would watch kind of groups of 2 or 3 hours of lectures at a time, and you absorb the information so much better in that sort of way. You do have to be quite organized with your time, so working full-time and doing if you properly want to engage with the content, you do have to give it time and set aside time for it. It is a full-time, it is a master's. So if you are very, very short in time, and I suppose 1 or 2 of the students in my group who are very busy, say pediatric registrar training, have struggled trying to watch all the pre-recorded lectures, but they're still getting a lot of benefit from it. For me, I mean, I'm a dietitian, so I suppose I don't necessarily work, say, with rhinitis or asthma, but for me, all the content has been so applicable, because a patient comes into your clinic room and they're awash with questions. And so me being able to give confident answers and having the confidence to know when to refer to the allergy consultant or differential diagnoses. I would say that when I look back on my clinic notes from a year ago compared to now, I'm a different clinician, which is nice to see. So the quality is really amazing. I'm doing the blended fashion, and I absolutely love the in-person days, as well as the freedom of having the time to watch the lectures online, the meeting the other students and kind of forming friendships. And we're definitely, as Harriman said, a nice close-knit group. We have a WhatsApp group. We text each other in panic the day before we have our group presentations to make sure everyone's on top of what they're supposed to be doing. And everyone is so friendly, and it's nice to work with both nurses and doctors and even non-healthcare professionals in the course to get a nice variety of views of what everyone is doing and everyone's perspective. Everyone has a slightly different perspective. Interaction with the faculty has been wonderful. Marta and Jen keep us on our toes, and they're so approachable. So anytime I've emailed with a question, there's a response within 1 or 2 days, and no question is silly enough. So I think that's most of my feedback.
Lovely, Aisling. Thanks so much. Sorry, I'm getting the cleaner to clean the room here. Lovely. So thanks a lot for that. So we open for questions. Okay, so please put your hands up or put your questions in the chat. Jen, would you like to add anything?
Just let me get my camera on. I don't know if people can see me. Hi, yeah, so I'm Jen and I'm the administrator, so I coordinate the course along with Marta. Very much look forward to seeing you online and in person if you wish to join the course. And yeah, feel free to drop us any questions here in the chat or get your cameras on. You know, we're very approachable, so we'd love to speak to you.
Lovely, great. So we open for questions. Any questions, anybody? I'm just checking the chat. There was someone struggling with the sound. It was working okay for me, so I hope things are better at their end as well. Okay, so quick things from me. So you know, if you're planning to apply, I will say apply as soon as possible. The process is relatively simple. I guess the application online, probably Aisling and Raman can share their views there. But in terms of, you know, what happens afterwards, I interview all the candidates coming to the program individually as part of the shortlisting process. But, you know, generally we get people very motivated with great CVs. So it's more of an opportunity to meet for the first time and you know, hear what you've been up to, what to do, etc. And for you to ask questions about the program. There's going to be the scholarships opportunity as well, and only people who have applied to the course are candidates for the scholarship. So that's another reason. Our students are generally very last minute, so they leave it to say June, July to apply, but generally international students wanting to do the blended option, which requires on-campus attendance and therefore it requires a visa. So applications generally close in July, so sort of towards the end of July, and it's, you know, very strict deadline. For the online stream, at least this past year, it was end of August. And again, you know, don't leave it last minute, particularly if you need to take, say, English exams, etc. So we've had students in the past who couldn't join because they didn't get on time for that, etc. So just don't leave it, okay, to last minute. Jen, any other thoughts there?
I have a question, if that's okay.
Of course.
What would be the setup for the online system if you have any specific learning additional requirements with videos, for example? So I'm dyslexic and I'm just wondering how that would work. I found out quite late in life, but remote working, I've not got any experience of that. So how would that work?
Yeah, absolutely. Thanks for sharing that. So absolutely, we've had students with dyslexia before, as well as other sort of special education needs, if you like, and it's worked really, really well for them. The college as well has specific resources for that, so they can help you have an assessment and point you in the right direction in terms of support, so helping with kind of learning skills for kind of adult learning, and that has been really beneficial for some of our students with kind of, as you say, a bit sort of newly diagnosed, you know, say dyslexia or other issues there. So there's resources, sort of generic resources in the college to support that. And then in terms of the materials we have, I guess there is quite a variety of materials. There's not much that is sort of heavy reading. Of course, there is a reading list, but, you know, it's not that you need to read absolutely every paper in the reading list. And if you're, you know, if you learn much better with a different format, like watching a lecture, doing some practice tasks with your group, you know, interacting with the live sessions, etc. You know, there's plenty of opportunity for that. And I remember one of our students 2 years ago, she had dyslexia, a lovely GP, and she never read the chat, and she will never type the chat. She will just put her hand up and say, you know, you're going all too fast here. And it, you know, for her, it was absolutely fine. But, you know, I hope that answers your question, but I will say there's not much in terms of heavy reading, if that sort of helps. And there's a lot of different types and lots of practice, lots of seeing, talking type of thing.
So that's good to hear, because I've found out that my learning style is better auditory, although I got through a degree already, well, a couple of degrees without really knowing that I had a problem. So it's not that the heavy reading's an issue, just if obviously it's very different face to face. But also, yeah, I'm interested in the whole reading side of things as well. So it's good to there.
Great. And all the students get a personal tutor who's not linked to the course, is part of the department, and they're very much sort of academics working, you know, in research with strong links to kind of teaching and education. And they're very aware of the resources available, particularly for things where, you know, some people might not feel comfortable, you know, disclosing certain things with, say, the program team, you know, and they point you in the right direction with absolute confidentiality. We keep confidentiality about everything, so we get to know a lot of stuff, you know, people applying for mitigating circumstances, we absolutely, you know, confidential. A couple of other things, so, you know, people with dyslexia might get, you know, an extension, say if there is an exam with a set amount of time, so you apply for a, you know, like for an extension to have extra time. And we've had that a couple of times in the last few years, you know, that sort of thing.
No, that's great. Thank you.
Great.
Sorry, just to touch on this again, there's a couple of other things. So captioning of videos, the sort of software we use called Panopto, everything is auto captioned, and you can slow it down to, you know, suit the speed in which you would, you know, so all the kind of accessibility side of stuff the college is really hot on. So
great, thank you.
Do you have any other questions?
Oh, sorry. Yes, it was just about where. Sorry, excuse me. The scholarship aspects. Would that be, as a student with dyslexia and working, would that be something that would be the same process, or would that be something different?
You mean the scholarship?
Yeah, if I was to do an application through that kind of, is there a different process because of that, or not?
There's no specific process, but, you know, you're asked to kind of submit all your different bits as in the normal application in terms of, you know, qualifications, etc., your CV. And then there is a motivation letter that you can also kind of, you're also asked to put in the normal application. So I guess you can add that there, you know, so it's not just, you know, to award a scholarship is not just about academic merit. So there's a strong focus on, you know, people with a good track record of good academic performance, but there's a lot about motivation, sense of career progression, you know, ambition in a good way, and career plans. And of course, you know, someone who has additional challenges, be it, you know, a difficult background, etc., that, you know, that's part of, you know, kind of a potentially a rich application, like people being able to kind of overcome the difficulties because they have a very clear goal and they want to do well and you know, learn. So, but there's no, you know, a set sort of different process or anything like that. Yeah. Okay,
so it's a normal process, because there's a very big difference in my before I found out between my written grades and my practical, huge. So
yeah, I mean, honestly, I wouldn't worry about that, you know, and generally, you know, because I interview all the candidates, I generally know everybody who's applying, and I'm part of the panel, and sometimes it comes to kind of relatively subtle things, because we have good, generally really good applicants, and it might be things like, you know, perhaps someone hasn't had a fantastic opportunity, you know, to have amazing grades or lots of publications, but you see the passion, you know, and that has a lot of value as well. So I would definitely encourage you to apply if you're interested.
And how many places are there
for the scholarships? So pending confirmation, it's probably gonna be 4. So basically it's 1 at 50% of the home fees for PGCert. So basically we help our own scholarships that the department offers, so NHLI, it's basically covering the first year fees based on home fees, so that sort of amount. So there's 1 that is 50%, so that would be like 3,500, and then 3 that are 30%, so something around 1,000 something. And then that's going to be sort of confirmed shortly and put on the website. And then we, you know, there's a lovely charity that has agreed to fund an MSc student, sort of 50% of the home fees for the whole MSc starting this coming academic year. And it's a charity of parents who lost her daughter very sadly due to perioperative anaphylaxis a couple of years ago.
Is that the
yeah. It's not the Natasha Foundation, it's a different foundation, so it's the Breeze family charity. So yeah, they've been doing some nice education initiatives and research initiatives in South Africa and Israel, as far as I'm concerned, and yeah, that's starting now. So it will all be on the website, but we haven't sort of, finalized that, so the whole thing. But it's
and the actual number of places for the course itself, how many places are there for this cohort?
Yeah, so generally we had around 25 students over the year, so 20 to 25, 30 students. So this year we have 30 students, so 10 in the online cohort and 20 in the blended cohort. So we're probably looking at similar numbers, probably something around that sort of overall number. So still you get to know pretty much everybody. So
that's brilliant. Thank you so much. Great. Sorry, lots of questions. Thank you.
Lovely. Any more questions there? People want to put their backgrounds in the chat or where you're from. I'm always curious about that. They see lots of different names. Lovely. So this year we're very happy. We have a bunch of people from around the world, which makes it really rich. So we have people from Australia, Singapore, Hong Kong, Canada, Qatar, yeah, and then a few Europeans and UK and Ireland, so yeah, quite nice. Lovely. And I guess we can put the shared email, the email for the program. It was on my slide, but I'm just gonna put the email for the program in the chat in case you have any questions later on and you want to get in touch. So
yeah, exactly. We'll be circulating the recording of this session along with a little survey that I'll just post in the chat as well. And yeah, just get in touch with us via email.
Yeah. So there's going to be 2 other sessions coming this sort of spring. So there's a research showcase, nice event that we're going to do on the 29th of March. I believe it's 5 p.m. But you probably will get an invite to that if you're interested. So we're going to have Professor Adnan Kustovic and Dr. Paul Turner talking about the latest in their fields. And that's one. And then we do the open day, which is basically the same thing pretty much as today, with probably a few more slides even. And we generally do it around sort of early June. So if you want to join that one, or colleagues, etc. So you might get sent the info for that as well. Okay. So any final questions? Otherwise, we will probably close the meeting. And I will head home. Great, lovely. Yeah. So thanks for joining, and thanks Raman and Aisling, and of course Jen and Rachel and Helen for being there. So thanks so much, and just get in touch if you have any questions.
Yeah, thank you.